So I think we'll get started. I guess I'm going to stand here. I hope this doesn't feel awkward. Let me just join you up front. Welcome, everyone. My name is Sue Perdue. I'm the Director of Grants and Fellowships, the position I've been in for just a year. Linda was a fellow long before I arrived on the scene. Linda was a fellow in 2021. So today we're having a conversation. Linda had asked specifically not to do a talk, but really wanted to talk about the book with someone else. And Iran was a perfect choice for that conversation. So let me tell you about Linda. Linda Janet Holmes is a writer, independent scholar, and a longtime women's health activist. She's dedicated her career to shedding light on the historical and cultural value of traditional African-American midwifery, which is the subject of her book that she's talking about today, Safe in a Midwife's Hands, Birthing Traditions from Africa to the American South. So Linda was a fellow with us in 2021, but we weren't in the space at the time, and she was remote, so we've had a hybrid relationship with her. This is her first time in person. We're really excited to have her here. In fact, this is our first fellows talk since we've been in this space, a little over about a year and a half. We're really pleased to welcome you here. We'll have a conversation. We'll have some time for Q&A, and then we have some cookies and drinks, coffee, tea, and then we'll, if you want to take a tour of our space, we welcome you to take a little gander around. Feel free to come on up here. We've got seats up in the front. And then let me tell you about Dr. Irene Mathieu. She's a certified bilingual pediatrician who cares for English and Spanish-speaking primary care patients in Charlottesville. She works at UVA Hospital right up the road. She's also an assistant director of Health Humanities in the Center for Health Humanities and Ethics. And she's also a poet and a novelist. And she's also working with us to partner for a Health, Equity, and Justice Fellowship, which is new to us, which we'll be announcing soon, that we are co-sponsoring, if you will. A final word about the books. We were unfortunately couldn't sell them today. We gave you a link to order them from OSU Press in your invite. There's some forms in the back. They're not order forms, but they're more information. But if you have any trouble getting the book, let us know, because you do get a 30% discount. Finally, restrooms are down the hall, which in the right, kind of straight down that way. And I think that's it. Welcome. Thank you.
Okay, I think this is on, correct?
Yes.
Thank you all for being here. I'm very excited to have this conversation today with Linda Janet Holmes. For those of you who have read the book, you know that it's really a spectacular work, sharing stories that I personally was not familiar with and I don't think are very widely known. So first of all, thank you for doing this work. Those of you who haven't read the book yet, hopefully this talk today or this conversation will encourage you to please go out and get a copy. And I wanted to start really just by inviting you to read maybe a passage from the book that you think exemplifies what this work is about.
Thanks so much for that introduction. As I was looking through the book, trying to decide, which of the passages to select to read from, I thought I very much wanted to read from the chapter which is called From Hampton to Charlottesville. And I am delighted that actually some members of the family of the passage that I'm getting ready to read from are here with us today. And I chose this passage because I thought this story really reflected some of the traditions that I learned about when I went to Africa. I was in Ghana, I was in Ethiopia, I was in Kenya. And before that, I interviewed midwives in Alabama back in 1981. And many of the traditions and the reasons that midwives were so respected were captured in the story that I'm going to read. And it included the fact that many of the midwives I interviewed were lineage midwives. They had learned from their mothers, from their grandmothers, sometimes from their great-grandmothers, the skills and the traditions and the practices. And the midwives were also respected, not just as birth attendants, but as folks who were as women who were very concerned about the whole being and the well-being of the family, not just the mother. And they were often respected for the work that they did in terms of the community. And all of this is captured in the narrative that I'm getting ready to read now. And I met Flora Ragland Washington, 85 years old at the time, who was the first midwife that I interviewed, and she lives in Cobham, Lewis County. And her mother, Earlene Elliott Lewis Ragland Washington, is the extraordinary midwife that Mrs. Washington describes in the section that I'm going to read. And I think I just also, as I mentioned, the fact that this is a lineage midwife whose family, her grandmother, even on the paternal side, is reflected in her practices. Mrs. Washington. Oh, yes. Oh, yes. My family, my mother and grandfather, it was well known that if somebody got sick, they would sit with them in the home and do for them. My grandfather was a good friend and that kind of stuff. People would call him for sickness in the family. If somebody was sick and they weren't getting well, they would call on him to come for prayer. He'd grab his old black robe. You'd see Grandpa walking, going to somebody's house for prayer day and night. He kept faithful. People would call him for sickness in the family, and they would get well. My grandmother, I think she did some midwifing along with a sister she had, somebody named Lena. My grandmother was a Mahane, and she still has a lot of kin people through this area. Her mother was a black lady, and her father was white. Turn the page. I think my mother might have had a third-grade education, but then that was doing something. I know she could read and write, but I don't know how much education she had, because if you had a third-grade education, you had something. When I started school, they had a school bus for white children, but black children always had to walk. It was a long way and it was hard. My mother went to meetings to raise money for a school bus, so we didn't have to walk to school. I don't have any of the record books from her being a midwife. I do have some pictures of her down in Louisa, because that's where they would go to have meetings and things. I do have those. And I know there's a lot of black ladies in that picture, and they were midwives with her. But I do not know any names, because all the time I'm young, and I know my mama be gone a couple days, or maybe a day, or she may even be gone overnight. But she was blessed. I think the only time that she lost one child during her time being a midwife was because she had called the doctor. The doctor came in and he wouldn't listen to her. So the baby passed. I think the girl passed too or whatever. She said, I kept telling him that this lady needed to go to the hospital and he wouldn't listen. He kept saying, no, no, no. I do know she always talked about that. Yeah, they learned. It's impossible to know how many babies she delivered. I'm trying to think. Oh, we often thought about that as we got older. If they had just kept a record of how many babies my mama brought in. But I think really my mama brought into the world just about every child around here in this section. So before returning to my car after the interview, Mrs. Washington suggested that we go back to the old family home place near the original church that her grandfather built. Some of the mothers she delivered, like Maxine Holland's mother, would visit or attended Malkin's church. Holland said, quote, she delivered just about everybody around here, including me. In a 2018 Juneteenth ceremony, the Cobham community recognized Malkin's long time service as a midwife. And I'm really pleased that members of this midwife family is here, and so is Maxine Collins. And so that's the passage that I wanted to read.
Thank you so much for reading that. I think one of the things that illustrates so beautifully is one of the features I love about this book, which is just the sheer extent of the direct quotes that you include from the midwives you interviewed. And I think that really adds a richness to have people's stories in their own voices from such a variety and diversity of locations and cultures. I did want to ask, you mentioned the idea of being a lineage midwife, and that was something that struck me as so continuous. In every place you went, it seemed almost every person you interviewed talked about someone in their family who had sort of inspired them or taught them or kind of been the impetus for their entering this career. And I wanted to ask for you as a writer and as a health equity advocate and all of the work that you've done, who is your lineage? Who are those influences that kind of brought you to where you are today?
Okay, so I was actually born in Newark, New Jersey, and my mother's family is Kentucky, and my father's family is South Carolina, Edgefield, and the first person I ever interviewed for a tape-recorded interview was actually my grandmother in Kentucky, and she was very hesitant about the interview. But when I told her that I thought the history was important, that people need to know the history, like similarly with this book, she finally agreed to the interview. But in the course of doing this book, I also learned something that I didn't know, which is that there's a traditional midwife in my own family. And I think that one of the reasons that I wrote this book is to encourage others to begin to do the work of digging into their own ancestry and finding out, one, whether they might have come into the world through the hands of a midwife. Because it wasn't really that long ago when Virginia, I think it was in the back, maybe the 70s, where they started passing laws across the South eliminating midwife practices. So there are mothers, certainly, and there are midwife descendants, certainly, who recall those practices. And being able to hear the voices of those who actually knew midwives and knew their contributions to the community. But I think in terms of my own family, ancestry collection, every time we have a family reunion, we want to hear the stories from the elders. We want to make sure that our children understand the importance of the roles that our elders and those who are no longer with us played in the Black community and how they helped others to navigate the system and to provide services. And so I think what I learned from the book is that there are countless midwife stories out there yet to be told, and to begin with your own family, to find out, is there a midwife in your family?
Thank you. When I was reflecting about this book and this talk, I was thinking of the word storytelling, but also the idea of story keeping, and that what you've done here is not only storytelling, but also the collecting and the keeping and preserving and archiving of stories. You talked about your grandmother's hesitance when you first tried to interview her. What was the reaction from the midwives, generally speaking, that you interviewed for this book? Were they excited?
I was so surprised how welcoming the midwives were, both in Alabama and also in Virginia, meeting the descendants of midwives and meeting those who had been attended by midwives at the time of birth, because these otherwise would have been forgotten stories. So when I did the work in Alabama for the stories that are in the book, they had just passed this law. It was really I mean, it was, I would say it was unjust, the process. I mean, some of the midwives, they just got a little notice in their mailbox. Someone might have a nurse might have knocked on their door and said, you're no longer a midwife. After generations and generations of doing the practice. And I, at the time, was living in New Jersey, and I thought, I had a Honda Civic with a New Jersey license plate on it, and I thought, would they talk to me, right? Because they wouldn't be able to ask their neighbor, do you know this person? Can I trust her? But they were so honored and pleased that someone was taking the time to collect their stories. And then here also, I think again the idea of recognizing and celebrating and being able to have their stories as a part of history. The stories that I collected in Alabama, those tape recorded stories are now on deposit at Smith College because they provided consent for that. But what I'm thinking now here in Virginia is that I will be reaching out to the descendants of the midwives and the persons that I interviewed, because there's only just a small portion of their stories here, to find out if libraries and archival opportunities to make certain that these stories are not just known for those who happen to read the book, but someone who might 100 years from now want to know about these stories. But the midwives wanted their stories known because they had attended hundreds, sometimes thousands of births in their communities. And once that generation who they attended are no longer here, their stories will be lost.
Thank you. One of the things that also really struck me in the book was just, from an oral history standpoint, the incredible success of the midwives and their skill in what they were doing. And one thing that was really interesting is thinking about kind of reproductive justice broadly. Many of us are familiar with some of the statistics around reproductive disparities in the US, which is very much tied to structural racism. But I was really interested to learn that in many of the African countries you went to, traditional birth attendants and midwives are very similarly being sort of kept out of hospitals and more medicalized birthing spaces, and that there are increasing numbers of people who are being sort of pushed into C-sections and higher levels of intervention and medicalization. And I would think that the same kind of forces of structural racism are not at play in some of those countries. So I was curious, what are the reasons for that, or kind of the parallels you see in both the US and African contexts?
That's really a great question, because I think even here in the United States, which you all began in Virginia and across the South, that there was this belief that once we move birthing to hospitals and incorporate the so-called Western model of care around birthing, that there would be improved outcomes, right? Mm-hmm. So the campaigns were, if we move births into medical centers, there will be a reduction in infant mortality, there will be a reduction in maternal mortality, and we will see increased well-being among mothers and babies. And so we know in the United States now, based on statistics and outcomes, and of course the most well-known story of Serena and others, because we used to think about it as being, if you were poor, if you didn't have a good education, that all those things contributed to poor outcomes. But now I think we understand that it's much more complicated than that. And issues of white supremacy, racism also, when you don't have that strong bond between mother and the provider, can be a cause. But I think that the idea of being modern, right? Mm-hmm. What you see on television, being rescued by white doctors and white hospitals, but at the same time, they are doing studies now. There's some really excellent studies that are looking at mothers resisting going into the hospital because they know that when they go into the hospital, more than likely they'll be sedated using pharmacological medicines. They are concerned that many of the rituals and the traditions that they're, from the beginning of time, that have been passed on, like naming ceremonies, the foods that they eat, and that whole idea of rest and restoration following birth, that was very much protected by midwives and in traditions within the African community. You know, that really having that time to rest and be restored. And many of the midwives would actually stay with the mother or come check on the mother for weeks, similar to what doulas are doing now, for weeks after the time of birth. And one of the things that helped me to develop this bond with the midwives that I interviewed and have trust for me is that at the end I asked them, what messages do they have that they wanted me to be sure to include in the stories that I was telling? And they said, we want the world to know that our traditions and our rituals, like, oh, the other one was burying of the afterbirth, like the ritual around. We want those traditions to continue, and we also want more to be done to understand that we all got here through the hands of a midwife, and we are alive, we are well, and that it is a misrepresentation of many of the studies that have been done that are not, statistics can be used to tell the story how you want to tell the story, but midwives are not at the table, the communities are not at the table, organizing how we go about collecting the information about midwives. And I think I answered your question because
I think that's really fascinating to hear that those studies are being done. And I think one of the things this book does, and work like this does, is it sort of increases our awareness as a society of the ways there are to birth, and to birth successfully and healthfully. And for people who are birthing or thinking about birthing, it sort of gives you a wider array of options, because I agree with you. I think certainly in the US and probably many parts of the world, there's such a narrative that going to the hospital and going through birth in a very medicalized way is the only way to do it, or the best way to do it. And I think just knowing what else is out there and what has worked for people, even something as simple like different types of birthing positions, can be really empowering. If I can share a quick story, I remember when I gave birth, the last thing I was thinking about was the afterbirth. I didn't have any sort of connection to any cultural tradition of keeping the afterbirth or doing anything in particular with it. And it all happened so quickly, and I gave birth, and then I had my baby, and it was just, a rush of emotions and excitement about bonding with the baby. And it didn't occur to me until hours later, I never even saw my placenta. And I felt a sense of loss that I didn't even get to just see it and thank it in a way for the work that it did. Because it's really incredible. You grow this entire new organ for this sole purpose of keeping you and another human being alive. And I really felt a sense of loss around that, and thought, if I could do it again, that would be something I would make sure my birthing team knows. I just want to be able to see it, So I think these stories kind of really illuminate all of the different ways there are to birth.
Sure. Yeah. Because I think that one of the problems and one of the reasons that there's an ability to eliminate midwives without a lot of protest, right, is because that there wasn't an understanding that many of these traditions that were being classified by the medical community as being superstition, as being backwards, as being ignorant. In fact, and this is really at the core of my book, these are traditions that they learned from their mothers, from their grandmothers, and from their great-grandmothers, that survived enslavement, that survived the Middle Passage, that actually are parallel to the stories and the descriptions that I heard when I was on the continent. So we talk about that in terms of religion, we talk about that in terms of dance and music, and we celebrate those traditions that were sustained from our African heritage. But that has not yet really happened in the way that it should, so that there should not be embarrassment about being able to continue with these traditions. But it's really a kind of celebration, similar to naming ceremonies that many folks in the Black community participate in now. But to see the connection, to see the thread of being able to hold on in spite of Jim Crow. And also, you mentioned the alternative birthing positions. Many of the practices that the midwives used now have been studied in the Western model of science, right? And so, in terms of working with gravity, right? The lying flat on your back to have a baby, the best way to have your baby is, if you're having a healthy childbirth experience, is in the upright position. The other one is massage. So massage for comforting, but also massage for positioning the infant in a way, and that it is having a normal childbirth head first as opposed to being in a more difficult position for delivery. When I was in Kenya, the newspapers in Kenya had really recognized, and doctors had recognized, the hand skills of midwives to prevent cesarean sections because of their ability to position the baby in the appropriate position for birth. And of course, also massage, as doulas often do, and midwives do as well, for comforting and for supporting.
Yeah. That's such an interesting example because I'm thinking of the pediatric corollary as well. There are many cultures where massage of infants and newborns is really an important part of caring for a new baby. And increasingly there are studies that show that from gastrointestinal to immune system function, massage really has a variety of benefits for babies, especially for very young newborn babies when done appropriately. And so, I think one of the things I struggle with as a physician is the fact that in medicine, we really don't know it all, but yet I think the culture of medicine tries to kind of act like we do in a lot of ways, and I think there's a need for a lot more humility. And I'm curious, you talk at the end of the book about winding down, the idea of midwifery sort of winding down, and at the same time, you've interviewed wonderful folks, including people in our own community who are doing doula work and other types of birth support work. So I'm curious what you see as the future of birthing, particularly in the context of what we know about how medicine is not working for some people, and the fact that we do have all of these amazing traditions that we can maybe apply again to address some of these issues.
Well, my daughter keeps pointing out to me that one of the exciting things about the book is that it's being embraced by the nursing community and being used with being incorporated into curriculums. I received an email just yesterday from someone in a nursing program who said that she wanted to make sure that this was a part of the curriculum that she's developing for the next semester. But when I came back from Alabama in 1981, quite frankly, I was depressed. I was concerned. This was when the midwives were being eliminated. Now, in the midst of the birthing justice movement, I am thinking very positively that we have reached a time where we understand how important the history of traditional midwives in the Black community are, and in indigenous communities, and that the time has come to embrace and celebrate the lessons that we can learn from them, and that there is more science going on, because there are lots of folks that don't buy the qualitative research, they don't buy the stories, but they can see the statistics. They do, which I think is ways of knowing, right? I support ways of knowing that come through the qualitative, through the stories, as being as truthful as the ones that come through the statistical studies. Yeah. So I'm very optimistic, but I think what has to happen is that the birthing justice movement has to remain strong on the community level. And I think that the awareness is growing, but what we know from the civil rights movement, from other movements, that you make 3 steps forward and then the spotlight shifts to another issue, the funding changes. So we just have to stay on guard and to continue to be involved with the birthing justice movement now. That would include continuing the practices of the midwives that I read at the beginning of this conversation, and that will lead to, I have no doubt, to improving birthing outcomes for Black mothers and Black mothers.
I want to just check on the time to make sure we have time for audience questions.
Oh, we have a lot of time.
Okay. But I do want to switch gears and ask you a process question. As a writer who also has a career in health equity, which I know you have done as well, and kind of public health standpoint. Well, first part of the question, I guess, is can you talk about the process of writing this book? As you mentioned, you did the first interview in 1981, and you most recently were interviewing folks, I think, up until 2021. So it was a pretty long span of time in which you went to many places, interviewed a lot of different folks, saw cultural changes in healthcare as this work evolved. So I wondered if you could talk about that process, how the book was born, and I guess I'll leave it there and then ask a follow-up question.
Okay. So this book really comes out of my own childbirth experience, because I was so disappointed. I was very involved with the Black student movement, So I had my list of demands, right? I wanted, dad in the delivery room. This is in the 1970s. I wanted rooming in. I wanted to be able to breastfeed on the delivery room table and all of that. I wanted to be active and walking during labor, not, strapped down to the bed. And all of that was kind of, it didn't happen. And that's, I was angry about it at the time, but looking back on it, it was a gift in a way that fired up my ability to remain focused on this issue, even with lots of interruptions in between, to continue. But my first work experience after giving birth was with a nurse midwife program at the medical school in New Jersey. So I had an opportunity to learn a lot about how midwives care for women during the time of birth was dramatically different from my own experience. But I also learned that the way that midwifery was being taught in terms of the history to the students began with nurse midwifery and began with the story of the frontier nurses in Kentucky, who all happened to be white nurses emulating the British nurse midwifery model. But the stories and the history of black midwives, indigenous midwives, and even immigrant midwives. This was in Newark, New Jersey, right? And there was this incredible study that was done around immigrant midwives in the 20s in the Journal of Public Health there that showed that the immigrant midwives had better outcomes than the doctors at the time. But that history was not included in the nurse midwife history. So I was alarmed by that. I get alarmed about things. I was alarmed about that, and that's what led to my getting the fellowship at the time to go to Alabama and collect the stories. I had a friend who lived in Selma, and I said, "Are there still midwives around?" And she said, "Are there still midwives around?" She said, "Midwives got us here. It was midwives. It wasn't doctors. It was midwives." And that's true across the Black South, right? Up until the 1950s and 60s, the majority of babies born were attended by midwives. So that sparked my going to Alabama in 1981 and collecting the stories. I'm a single mom, so I had to work and make sure that that I was being a responsible mother. I was very involved in the Black Women's Health Project and other women's health initiatives at the time. But I kept thinking, the stories I heard in Alabama, there was this connection to the continent that wasn't being discussed in any of the books that I had read. And so that's what sparked, their story sparked going to the continent. But mom was working full time, and it was only when I retired and moved to Hampton to be closer to my daughter went to Hampton University, that I found the time and a way through a GoFundMe activity, through a fellowship here from the Virginia Humanities Foundation and so forth, to be able to go to Africa. So there was this gap. But in a way, that too was, the timing could not be more, a gift from the ancestors, let's say, that I actually went to Africa at the time that I did, and then was able to be here in Virginia to interview a generation of descendants who knew their mothers, folks who have been attended by midwives who were here, who can relate to how what happened in the past is now being restored through midwife practices and doula practices, not only in Virginia, but across the nation. And also, as you said earlier, to provide a source of information for those in Africa and in other places around the world that tend to have this kind of invasion of the Western medical model as being the only way. So having resources that provide opportunities to see how effective midwifery care can be.
It was a necessary gestation, and like you said, the timing is just really incredible because you saw sort of that decline of midwives in the 1980s, and then now we're back full circle to the resurgence of midwifery and also doula work and others, as we recognize that the medical model has not served us, or the medical model alone has not served us. I know you've written other books as well, and you mentioned you've done some journalism work, and I'm curious kind of more generally how you think about these sort of seemingly two careers of being a writer and also being such a strong public health advocate and public health worker. How do those careers complement each other or influence one another, not just in terms of this book, but in all of the writing that you've done?
So, I guess another reason why this book didn't get done until it did is because a couple of other books came in between. Tony K. Bambara, who's a well-known writer, was my mentor and my teacher at Rutgers University. And she was there, and Nikki Giovanni was there, and Sonia Sanchez was there, and there was just an emergence of Black women writers who happened to be there when I was a student. I'm very fortunate to be influenced by them. But the idea that Tony K. Bambara put forth is that being a writer, yes, but also being a cultural worker, right? So how do you connect this work of like not putting yourself in the ivory tower, with the closed door or on the mountaintop or in the woods or whatever, writing for the sake of writing, but how does this writing apply to making lives better for Black folks, for empowering Black folks? And so that's always been an issue for me. And even when I was working as a reporter covering little towns in New Jersey, I always looked for the Black story. I always looked for Black families. And these would be stories that weren't being covered by the new media. So that's always been part of my mission. And so I think that what came in between was the first book that I did, which was Listen to Me Good. That book focuses solely on the practices of one particular midwife who attended some 3,000 births in her community and worked closely with the health department there. It's a great study that was done by the CDC in North Carolina, where they found that mothers who had access to prenatal care through the health department, and they compared the outcomes of doctors who attended the births and midwives who attended the births. And this CDC study, scientific study, showed that it wasn't, enormously significant in terms of the differences, but the midwives had better outcomes. And so there just needs to be more of that kind of work. But the Tony K. Bambara book was the book that I did, which was an anthology, which really called forth, again, reaching out to writer activists, writer cultural workers to talk about the work of Tony K. Bambara. And so did the second book on Tony K. Bambara. So I've always seen it as my mission, whether I was working for the health department, linking with communities, making sure that people of color are always at the table. When I first worked at UMD&J, folks said, the director of the Department of Obstetrics said, Black women aren't, and this is in the 70s, Black women aren't going to be interested in this kind of midwifery care because most of them aren't married, most of them, many of them are, all the stereotypes, and I don't even want to repeat them because they don't need to be repeated, but all the stereotypic reasons. The Muslim community in Newark was so excited about creating a birthing space in hospital, and many of them having home births. But again, until I connected with the Muslim community, I was a sole voice. But once I connected with the community, that was the lesson learned again, bringing in the community, dispelling the stereotypes, letting folks know that Black women, Black families are very interested in home birth, very interested in having choices, very interested in birthing spaces in the hospital that are, not doctor managed solely, but referring to doctors as needed.
Thank you. I can so relate to that idea of writing as something that informs and is in conversation with other work, not as this thing that you just do in your private space for yourself or for some sort of, aesthetic or academic reason. And I really appreciate what you said before about qualitative data and just the importance of making sure that we are incorporating qualitative information when we try to think about strategies to kind of move this birthing justice movement forward. I wanted to, did you want to say?
Yeah, I was going to say, I was so impressed with the fact that when I went online to find out about her and it said pediatrician and poet, I was like, wow. And then just the whole idea of the kind of spirit that someone who is a poet was not just looking at the data, right, but is also dealing with emotions, with feelings, I think that it's, and I don't want to just say it's the doctor's fault, but it's the system's fault. I mean, this, like, you have 15 minutes to talk to someone and looking at the computer, not making eye contact, midwives who greet their moms with a hug. And with midwives, it's timeless. I mean, in Africa, nobody's looking at a watch. You know what I'm saying? It's what's needed. How can I be supportive? How can I provide the care? But I'm agreeing that I don't want to miss the opportunity for questions that might be coming from others.
Yes, I'm James Wright, grandson of Bernie Madam Marvin, and actually I'm 73 years old when she performed. She was a midwife from my birth. I weighed 9 pounds and 5 ounces, so she had her hands full. But in my conversations with her, she actually, not that she wouldn't do it, but she preferred not to do the first birth. I'm asking you, when you were in Alabama, was that the situation? She said that there are going to be any complications. It's probably going to show up in the first birth, with neither C-section or anything else that could have happened. The subsequent births that she said she had no problem with, and yet she did perform first birth as a midwife. I was just wondering, in your travels, that you find that the midwives prefer not to do the first birth, or maybe out of necessity or whatever else, they didn't address it.
Thank you. I'm so glad you're here. These are the living, walking testimonies, right, of midwives being able to certainly bring healthy babies into the world who grow into healthy adults. But it's complicated because we've been talking in very broad terms and generalities. And what I didn't talk too much about here, on the continent, most of the midwives had not been involved in any formal kind of linkages with health departments and so forth until recently. But here in Alabama and across the South, Tuskegee, for example, had a training program that really goes back to the 20s and 30s for the traditional so-called granny midwives in that area. And they would come for a week and they would have this program. And also in Virginia, there were programs that were at, I know there was one at Hampton Institute, now Hampton University, and there was one at Virginia State. And also health departments, beginning in the 20s and the 30s in Virginia and across the South, offered support and opportunities for midwives to have a more organized system of backup support if they needed to transfer. And sometimes it worked and sometimes it didn't, as your grandmother talks about in this story. But so sometimes the health departments also encourage midwives to really be concerned about making certain that they were attending the mothers who were low risk, right? And this was not the case across the board in terms of the first pregnancy, but I'm imagining that might have come from the health departments where she was getting her training or opportunities to meet with others who would say, let's make sure that women who may need more support at the time of birth get that support. However, I know there are like thousands and thousands and thousands of mothers who gave birth during their first pregnancy with a midwife and did well. Did you have a question?
Yes. Yes.
I am a UVA trained labor and delivery nurse, retired, and mentored by the woman sitting next to me. I'm curious if there's anything happening in medical training today that is exciting or encouraging on bridging the gap between the medical model that does need to learn how to do some of the more invasive and surgical, and you want someone good, so you don't want someone doing that for the first time, but they seem so mutually exclusive. In the world of working there for nearly 20 years, there was often it was hard to find that common ground, just even in conversation. It tended to be all one way, or we don't talk about the other. And I'm just curious if there's anything in either of your awareness that addresses any of that.
Sure. I mean, unfortunately, I'm not aware of a lot of concerted efforts. I will say, when I was a medical student, which was about 10 years ago now, more than that even, I really felt, and I went to medical school in Nashville, Tennessee, but I really felt that there was still this kind of cultural divide of birthing people who are kind of choosing to go along with the medical system, which are sort of the ideal patients that make things easy for us as providers, versus people who want to do alternative things like home births or have a midwife. And I felt that tension, and it did not feel good. Now as a pediatrician, I'm a little bit removed from birthing spaces, but what I do try to do in just my clinical teaching with medical students and trainees is share the data, qualitative and quantitative, about the fact that doulas and midwives are critical members of the birthing team. They have great outcomes, and now we are seeing more and more research that supports that, and we have increasingly things like Medicaid that are actually reimbursing for doula services. So we're seeing some of that data reflected in policy changes. So I try to share that sort of on a one-on-one basis with folks with whom I interact, and also kind of normalize in general the idea that people may be engaged in practices around their health that are not what we learn in medical school, and that's totally okay. If it's not something that's actively harmful, it doesn't really matter if you as a physician know if it's, what the evidence is or how good it is. If it's not going to harm the person, I don't think it's our place to say that it shouldn't be done or that it's not an option. And in fact, there are, as we've talked about, increasingly a lot of data to support things that we as medical professionals might assume are just, oh, that's a cultural thing or that's not really evidence-based, but actually there is evidence for. There's just one little anecdote I can share, from a pediatric standpoint that happened. So I learned a few years back that papaya seeds have an anti-parasitic function. And so often people in countries where papayas are native will feed their kids spoonfuls of papaya seeds to decrease parasitic burden. So it's a great practice. And, I've spent some time in Latin America. I would eat papaya seeds every now and then, like, oh, just in case, And I had a patient a couple of years ago who came in, and the parent told us they were feeding their child papaya seeds because their stomach was hurting. And the resident was like, what is that about? Is this some weird, old wives' tale? Like, what is this? And I said, no, this is a real thing. And there's actually a study you can find on PubMed where they did look at the parasitic burden before and after administering papaya seed versus a placebo to children in endemic countries. And this is a thing that works. So now you know, and next time, even if you don't know, if it's not harmful, don't assume that you have the answer, because the other person might actually know better than you.
Oh, did you want to ask a question?
I just wanted to make a comment on her question. My name is Doreen Bond, and this is Lisa Brown. We're both with Birth Sisters of Charlottesville, which is a doula collective in the community supporting women of color. And you wanted to know some of the things that are happening to kind of give the medical establishment more informed, more engaged into some of the unique needs that are facing, particularly Black women giving birth. We are part of a pilot program with UVA medical students right now. You probably heard of the patient-student partnership, but we've modified where we have some of medical students that have shadowed with us in working with some of our clients. And the idea is for them in their training, at early stages of their training, to begin to get an understanding of the unique needs that are facing Black women. Because they're not exposed to that. They're not exposed to those very unique needs. And we've been having the pilot for about a year now. We're about to go into the second year. But there was a lot of learning on both ends of you know, they were really fascinated by what they did not realize and what they would have never gotten in their training. So that's one of the things that we, you know, if we can start them early so that they begin to develop that compassion that is necessary, that bedside manner that is necessary, because those things are extremely important. Because when Black women go into the hospitals, there's a certain edge of like you're on, and you can't settle, you know. So that has an impact on blood pressure, possibly. It has an impact on so many things, and that can also impact the outcome of the birth. And so we're trying to do what we can to help bring this new generation of doctors coming in to develop that compassion, to develop that understanding and that knowing at this early, so that when they move on with their careers, they already have that instilled in them, hopefully.
Also, I'm sorry, just going to piggyback in to say that they have been really open to understanding the structural racism component, as well as historical biases and the racialized education that's been taught to them. And so that's great in terms of conversation and things that they can share. We provide them with a lot of resources and tools, and of course, readings, publications, that sort of thing to help them.
And we're also happy to say that we've been working, you know, as doulas. When you go into the hospital for a client, you've been considered a visitor. So that means you have to abide by the visitor rules, and we're not considered part of the care team. But this year, UVA has granted us access, and so now we're not considered part of the visitors. We're considered a part of the care team. So they have growing, getting that understanding of the benefits of having doulas.
That's really good to hear. Thank you.
I just want to say that Virginia is very fortunate. Virginia has really been in the forefront in terms of doulas getting reimbursement through Medicaid. The pilot program that you're starting now is really making a difference. Right, lots of
Yeah. First, I want to thank you, Linda, so much for including Miss Bradley in the book. She was my mother's midwife, and here I am, and I said, well, but she was such a powerful woman in the Almont County, Louisa County, Orange County, whatever counties, really a powerful woman. And thank you so much for doing that, because sometimes people come in and do local history and overlook local people. Thank you again. My question to you, during the 70s, the shampoo company had this placenta out, and I was in Hampton at the time when this was happening, but did you hear if they were going to birthing rooms, Maryland Hospital, to get the placenta to add to the shampoo, because placenta has a lot of protein in it? Have you heard that?
I don't. This is my first time hearing that about that. What years are you talking about?
In the 70s. You know, the shampoo was placenta.
But it was Pantene. Pantene did it. But I thought they reverted to using Cal.
But that was that they were going.
Right. I guess my immediate concern would be, I guess the issue also is about informed consent again, and whether the women were aware that was happening, and that would be my concern. But I don't know about that specific.
But you know, there were a lot of things going on that people, when you go into the hospital and they put this form them down in front of you and say sign.
Yes.
And I encourage people, don't do that, because that consent form in UVA needs to be changed too, because it says, I agree to allowing specimens of cells to be used as experiments. And I always scratch through that, and give them a history of why I'm doing this, because I'm coming from a population where Tuskegee and all these other experiments that we know of and don't know of. So you just can't do that. And they get to the point now, they want to summarize what you are agreeing to. And I'm going, oh, no, I don't care, this is going to take an hour. Line by line, I need to get some explanation for this. But that was the word on the block, that they were throwing the placentas away. And people were confiscating them and selling them to this country. And to the, various companies to do that. So, but the pharmaceutical companies and where we are in capitalism, it's not hard for me to believe that, that they would do something like that. But do the research and see if that really happens. Google it.
I mean, that reminds me of the story of Henrietta Lacks.
Yeah.
But also, there was a situation, I think it was also in the 70s or 80s maybe, in Haiti. A lot of people were talking about how don't go near the Americans, they'll take your blood. And the assumption from a lot of folks was like, oh, this is some sort of, mythology, legend. But no, actually they were buying plasma. American companies were buying plasma from folks in Haiti. And so, a lot of times there is some sort of truth in these kind of stories because people find out what's happening. And I'm also not familiar with that particular example, but I think it shows how there are a lot of reasons, very legitimate reasons people have to be skeptical and suspicious of the medical complex, for sure.
Remember the missing and murdered children in Atlanta?
Mm-hmm.
There was the word on the block that they were getting the interferons from those young bodies, to help with the research in cancer. So African American bodies are always being out there to be exploited, by these pharmaceutical companies.
And I think in terms of one of the reasons that I wanted to do the stories with the midwives is because, I learned from families, midwife descendants, about the issue of trust. And these were women who they not only knew them as someone attending them at birth, but they went to church with them, they knew their families, the families knew each other, they were witnesses to what they were doing in the community, like getting that school bus for children. So they were very involved with holistic care, so that, and there was communication, right? Everybody was speaking the same language as opposed to medical vocabulary and complicated consent forms. And so that issue of trust and bonding is certainly one of the things that connected the midwife stories in Virginia with Alabama and in Ghana and Ethiopia and Kenya.
Right, and when you go into a setting and you already feel like you don't trust the people in that setting who are going to do something very intimate and very personal and help you through this very personal process, and not only a lack of trust but potentially antagonism, you can understand why, as Doreen pointed out, people can be on guard when they enter a medical setting. Yes, one more question. Anyone else want to take the last minute here? Oh, sorry, I can't see. Whoever's hand is up, please feel free. Oh, yes.
Hi. Linda, thank you so much for this wonderful talk, and to Irene for your very insightful questions. This is kind of implicit in everything that you have said so far, but if you could say a few words about emotional well-being of new moms and moms who are, preparing to have a child, and especially in terms of what happens after they give birth and that, postpartum depression syndrome, support, emotional support that was given by midwives and doulas has been over the years. Can you speak to that a bit?
Just briefly, I would say that the reason that I'm hopeful and optimistic is because back in 1981, when I was interviewing the midwives, that tradition was essentially being lost to the Black community and to other communities. And I also want to emphasize, Black midwives delivered a whole lot of white babies as well. It wasn't just in the Black community. so in terms of the reason that I'm feeling hopeful, and I often don't feel hopeful about anything that's going on in this country, but I am very hopeful that doulas and midwives now, and I think it's important too for healthcare workers and birth justice workers to be aware that they are continuing a tradition, right? That there are lessons that can be learned, and this is not something new under the sun, but this is timeless. I mean, this goes back, some of the idea about birthing physicians. You can see them in the walls of the pyramid in Egypt, right? These are timeless practices in terms that have benefited mothers, babies, families for generations. But the caring part after birth, that medicalizing birth, really we lost that, right? And we had some visiting nursing, some of that was going on, but it's really doulas who have really picked up the baton and are carrying on that tradition with, often with a very wide scope in terms of the time limit. And as I said, there were midwives in Ghana and other places who really saw it as part of their care to see after the mother, not just for the day or the week or the whatever, but for weeks afterwards in terms of restoring. And that's exactly what's happening in this very important doula collective work that they're doing here in Virginia and elsewhere. And that's what gives me optimism, that hopefully that I can hold on to in the midst of living in this country that has all these, and then it's anyway. But I'm so glad that you're here also this afternoon.
And I also want to thank you for acknowledging doulas in your book as well.
Thank you all for being here. This has been fantastic.
Thank you. I think if any of you have